Welcome to Surrogacy Talk with me, your fabulous host and family building expert, Frank Golden. I'll be talking about surrogacy, IVF, and making babies. Hello, everyone, and welcome back. And today I'm here with Erica Daybook.
Hello, everyone.
Thank you, Erica, for being with us today. Of course, it's not a podcast without Erica.
I'm so flattered.
So today's podcast is going to center around the different stages of a pregnancy as kind of we see it from the surrogacy agency perspective. And we'll talk about some different things that take place at various stages throughout the pregnancy. And then just as a disclaimer before we dive into the subject matter here, Erica nor I are medical professionals. We didn't go to med school. We're not giving medical advice. Everything that we say is just through our own experience as we see it, again, through the surrogacy agency perspective. So I encourage you, after this podcast, if you have any questions about any of the subject matter, reach out to your own physician or do your own research. We are not giving medical advice in this podcast. And without further ado, Erica, I'm sure you have a list of questions.
You know I do, because pregnancy is complex, right? And that's why we're doing this. So let's go into the very beginning of a surrogacy. Let's go right to an embryo transfer. Mm-hmm. Let's talk about how the intended parents tend to feel during that time from your experience, and then kind of the overall process involved.
Yeah, so the embryo transfer obviously is kind of like the date of conception in the surrogacy world. You know, it's the day that you are transferring your embryo into your surrogate, and hopefully implantation will take place shortly thereafter, and you'll have a baby. So it's a momentous occasion. Intended parents and surrogates are really nervous, obviously. So it's one of the most major milestones. It's the beginning of your journey that you're embarking on with your surrogate. The surrogates are really nervous because they want to do a good job. They want that embryo transfer to work. They want to help you either start or continue your family. Hopefully your first embryo transfer is successful and you have implantation.
Frank always says be cautiously optimistic going into a journey. Technology's gotten better, right? I mean, so the success rates are great.
It really has. Most intended parents, at least through our program, are doing PGS or PGD, the genetic testing on the embryos, and we have seen success rates, in the 80 percentile, if not higher, when they are having their embryos tested in advance. And from someone who was an intended parent, and not being able to do genetic testing on our embryos because we didn't have enough due to our own circumstances, I always advise that if you can, do the genetic testing, because then you have peace of mind that at least you're giving your embryos the best possible chance for success. You're transferring in the best ones, even if, like you said, implantation doesn't occur on the first embryo transfer. At least you know that you are doing kind of everything that you can to make it happen.
Exactly. So. And you're kind of a solid expert on failed transfers. You've experienced some of your own.
Yes, unfortunately, but it's part of surrogacy. Right. It's part of pregnancy.
And you have 2 beautiful children, so you're proof that you get through that. Okay, so let's just say the embryo is stuck and pregnancy's been confirmed. Can you kind of go through some of that initial phase of a pregnancy?
Yeah. So your surrogate and surrogates out there, you will be under the care of the RE, the reproductive endocrinologist, and the fertility clinic until you're between 8 and 10 weeks along. So that's typically when the fertility clinic will release you. Fun fact, the baby that you are hopefully carrying is still considered an embryo until about 10 weeks, when it leaves the embryonic cell state and becomes an actual fetus or baby. So just kind of a fun fact there. I didn't know that. I did research. So, after the fertility clinic says, okay, everything looks good in this pregnancy. Again, you're usually between 8 and 10 weeks along, depending on the clinic's protocol. You will then be able to go off of your fertility drugs and start seeing your regular OB for your regular prenatal care, just as though it was any regular pregnancy. So you kind of carry on that way. I always advise that intended parents go to the first OB appointment just to kind of meet your doctor, establish that rapport, and really show their support. it's their pregnancy. They should be there to support you and to meet your doctor and be engaged in the entire process.
Definitely. And I would imagine that in a regular pregnancy, a non-surrogacy pregnancy, that women are very hormonal in that first trimester, a lot of mood swings, and especially since surrogates are still seeing their fertility clinic for, you said, 8 to 10 weeks, till they're 8 to 10 weeks pregnant? Is
Correct. Yep.
And they're still on medication. So that's just additional hormonal fluctuations that are naturally going to affect their mood.
Additional hormones in addition to just having to give themselves the injectable medication is quite painful. And I can't imagine. So yes, there are those side effects, mood fluctuations, a lot of morning sickness can occur. So, a piece of advice out there for everyone involved, and I think we've talked about this before, is that when you go into a surrogacy journey, it's important to have a really good match that's built on a foundation of trust. And you really want a great bond with your surrogate, because that first trimester is really difficult for the surrogate. She may, because she's on those additional hormones, she may feel differently than she did during her first pregnancy or her last 2 or 3 pregnancies. A surrogacy pregnancy can sometimes be a little different on the body because of all of the extra hormone drugs that they have to give themselves to maintain the pregnancy. So be prepared for kind of anything and just be supportive. If there's one piece of advice I can give, is just be supportive, be open-minded, and know that it's just part of the process. It's not your surrogate being an awful person or purposefully disconnecting. It's just she's going through a lot.
And just the stress of trying to get pregnant for somebody else it's a lot of pressure, because they just want to make their intended parents happy. And it feels like a failure if they failed you. So once they succeed in getting pregnant, they realize this is kind of just the beginning, and there's morning sickness and I'm tired. It can be very overwhelming for any woman, I would imagine.
The funny thing, but not like super funny, is that every time we have a surrogate that reports back to us in that first trimester, like even before she has the blood work to confirm pregnancy, and they're like, I'm starting to not feel well. I'm really, really tired. The agency support side of me is like, oh my goodness, that's terrible, and we're really supportive of them. But on the other side, I'm like, yes, high five, like the pregnancy, she's pregnant.
We love that.
It's like bittersweet, because it's like, okay, she's going through all these things, but it's a good thing because it probably means that she's pregnant. So it's bittersweet.
So let's move on to, I guess we don't want to focus on the negative, but it's important to address some things that could go wrong. I know that first trimester, spotting, right? I mean, we've had surrogates call and say, I'm spotting a little bit, and intended parents naturally get very nervous. Again, we're not doctors, but we just don't want anyone to get overly anxious if they hear that someone's
Correct.
spotting.
If you research, a lot of women spot in that first, especially that first, week or two following embryo transfer. Sometimes it's called like transfer implantation bleeding or cramping or whatnot. It's still something that your surrogate should reach out to her medical professional or reach out to the fertility clinic and make sure that it's within normal range. And they will advise if she should go in and get, like an emergency ultrasound or whatnot. But don't freak out. Again, be supportive, be open-minded, and know that it's nothing that she's done. It's just part of a pregnancy, essentially.
Exactly.
But you're right. There are things that can happen in the first trimester. Usually, if a miscarriage is going to happen, it usually happens in the first trimester. So we usually don't say that your surrogate or your baby's out of the woods until at least week 14. Week 14 is around when the second trimester is beginning. Sometimes it's measured between 12 and 14, but usually around 14. So I would just expect that. And then what I always tell everyone is, for me personally, you're really not out of the woods until that baby is in your arms. So until that point, just be as supportive as you possibly can.
By being supportive, you can attend the first couple of ultrasounds. You can just understand, maybe send her a thank you gift, just be there for her, and really start establishing that relationship for the long run. So let's move on to the second trimester and talk about what we can kind of expect there.
So second trimester, again, you're kind of out of the woods. It's your pregnancy's still fragile, but it's not as critical.
Right.
So your pregnancy is more established. Your surrogate usually will stop having the morning sickness, and she will start to feel better and start to feel herself again.
Yep.
She's not in the third trimester, so she's not too heavy or too showy. She's not too lethargic
Right. The
yet
baby
in the
bump's
pregnancy.
just starting to form.
Right. So she's starting to feel good, like her old self again.
But if she, for whatever reason, your surrogate does have morning sickness still, I had a friend who had morning sickness throughout her entire pregnancy, unfortunately, and it was fine. Her doctor wasn't worried. She was gaining weight. It was just unfortunate.
Absolutely. And during the second trimester, your baby actually does the most growing in the second trimester. Like all of the critical,
awesome.
The nerves and everything is forming, bones, skin, everything is basically coming together in that second trimester. So it's a very important and momentous phase of the pregnancy. And because your surrogate is feeling better, it's also a really good time if you'd like to go to where she lives if she's not local and visit with her, or she can still travel to where you are and kind of spend time being together and enjoying the pregnancy.
It's a good time to travel is the second trimester, so that'd be a great time to send her on a little trip to visit you, visit her, or treat her to like some kind of pampering, like some kind of spa treatment.
Yeah, that's a really
That's
great
really
idea.
common that a lot of intended parents, they do that, you know?
Yeah, send your surrogate to get a body massage or a day at the spa. She will be so grateful. And also the 20-week anatomy scan, so most OBs do that, is it's at 20 weeks. So that's a huge milestone. I always encourage intended parents that if you can't make it to some of the more minor appointments, don't stress out about that as much. Definitely try to get to the 20-week because they literally measure every part of your baby, and you get to see your baby on the ultrasound, and it's just really magical. And it's you finally, in the earlier stages of a pregnancy, you're looking at the ultrasound, and you're kind of trying to decipher what is that blob I'm looking
squirrel?
At the 20-week ultrasound, however, you can see a baby in there. The shape of a baby is clearly there, and everything becomes even more so real that you will be parents very, very shortly. So definitely go to the 20-week, huge milestone.
What ultrasound was it that you knew? So Frank and Adam implanted 2 embryos and kind of wanted to see which one would stick, and maybe both, but one stuck. And I remember you telling me that in an ultrasound you saw Sophia, and you just knew by the shape of her head that was Adam's child. You're like, that's Adam's head.
It might have been like the 20-week when she did the 3D scan, the 3D image. It was still really blurry, but I could see the forehead, kind of like the cranial, the structure, and I was like, that's Adam. Adam's in there. That baby, that's Adam. And we already knew that it was a little girl. So the whole time then I got to make fun of Adam. I was like, you're having a little girl. Because, I knew as 2 men, you always think, okay, we're going to have a boy. It's going to be a boy. And then when we knew we were having a girl, it was a nail biter. We were like, which one of us made a girl? Oh my God, what's this baby going to look like? Because I think it's harder when you're the opposite sex of
to
your
imagine
child
your face.
that's in utero. What are they going to look like? I made a girl. So what does that translate to from what I look like?
Sure.
So it's kind of fun. I got to make fun of him, but you're exactly right. I knew it was a baby related to Adam immediately. People thought I was crazy, but then as soon as the nurse handed her to us at the hospital, I looked at him and I was like, I won that bet.
Told you.
Yes.
One of my favorite stories. So we are now moving out of the second trimester and on to the very exciting third trimester. What are some things that we can expect there, Frank?
So the third trimester is, really your pregnancy is even more so out of that. You're out of the woods, out of the danger zone. You're more stable. Your baby has done all of the most important growth. All of the nerves, the bones, everything is formed. The third trimester is really about just trying to pack on as much additional weight and baby fat and everything to the baby before delivery. Lung development, the lungs continue to develop so that your baby, upon delivery, can take their first, gasp of fresh air and have proper lung development. So it's just kind of your baby putting together the final touches in preparing for delivery, essentially. But as a surrogate, and again, I've never been a surrogate, so
You
I'm
haven't?
isn't that shocking? But I
totally thought.
from all the surrogates that we have been so honored to work with, and then our own surrogates, the third trimester can be really tough on surrogates because they're at the heaviest point of the pregnancy. So their mobility may be strained, especially if it's a summer pregnancy. It's really hot out. They're even more so then they're kind of feeling a little more lethargic and tired again, having to, as we noted in here, frequent bathroom use for sure.
Oh, sure.
They're definitely at the point where they're having those Braxton Hicks contractions. They're preparing for, their body's preparing for delivery. So there's some pain and cramping that accompanies that as well. And then as surrogates even inch closer to delivery, I'm sure they start thinking about where they are in public, because if your water breaks and you're at the mall, so I'm sure all of these things start to go through their minds essentially. So it's, but it's a really fun part of the pregnancy. Intended parents are finalizing all of their items on their, either if they need things for their gift registry they haven't purchased yet, or putting the final touches on the baby nursery.
And they've already done their pre-birth orders in the second trimester. So this is really a phase where they know it's really coming together. Their names are going to be in the birth certificates. Really exciting time. And for the surrogate, again, it's stressful, right? I mean, she's getting ready to deliver. And for me anyway, I would be so open to having intended parents in the room. Everyone can come and we can make it a party. And then as it's getting close, you start to realize, well, I'm going to be in a very vulnerable position and in front of these people that become part of a family maybe, but are still, it's so personal. So there's some of that, and they have their own kids that they're chasing after.
It really is. And so for intended parents listening to this, it's good to go into your journey and make kind of like a birth plan, or have a plan. If you don't formalize it in a quote unquote birth plan, which is kind of like a document, at least have those discussions with your surrogate about, does she want you in the room during the delivery, and how all of that should kind of play out. But note that things can change at the delivery. So I know for Adam and I, our surrogate, she said definitely she wanted us in the room, but during her while she was laboring, she did want us kind of out of the room, because it can be kind of uncomfortable and really kind of tribal, and there's a lot of grunting and uncomfortable things that the surrogate has to go through. And quite honestly, they don't want some, even though you build a relationship with your surrogate and you're with them for 9 months becoming friends, it's still very
personal.
It's like you don't want anyone in the bathroom
weird in front of their husbands. Like, they feel weird about it, and some women don't, but either way, there's no right or wrong. It's just something to understand that your surrogate might, at the last minute, kind of like feel a little bit weird about it. And
so don't take it personal and be like, oh my goodness, she's kicked us out of the room. No, that's not it. We just need to be respectful. For Adam and I, then after our surrogate, laboring and Silas was coming out, then they kind of sashayed us to the other side of her, and then we got to see him like literally be pulled out. It was like a magical experience. So regardless of how that plays out, just know that the game time decision sometime made to be more respectful to the surrogate, and you want to try to be there for her and be supportive.
So part of the birth plan, talking about a post delivery relationship with your surrogate, you might want to have a plan for that, right? I mean, what do you think, Frank?
You do. So when you're working with an agency, we put a lot of those things together in the legal contract. We try to give that advice when the contract is being formed. Not that the relationship should be, governed in such a black and white way. It's just more of an outline so that there's a reasonable expectation set. Yes, that can change. A pregnancy is a very long, difficult thing sometimes, and relationships and feelings do evolve, but it's good to kind of have a plan. So if your journey is built on mutual trust and a strong foundation, depending on how that communication rhythm is formed throughout the pregnancy, that might continue on after post-delivery. For Adam and I, our first surrogate was in Pennsylvania. We're here in Illinois. So our relationship carried on much as it did throughout the pregnancy, with texting and phone calls. And it was kind of even more exciting after Sophia came into the world because we were able to send her texts of pictures. I would like photobomb her with photos of Sophia eating breakfast, and I'm like, look, she's using a spoon for the first time. And so you get to share those milestones with the woman who helped bring your child into the world, and it's really special. And hopefully that's the relationship that you have. We're by no means saying you should have your surrogate over for for a picnic every weekend or be besties. That's not the expectation, but at least celebrate those milestones, let her feel appreciated, as she should. And
as much as it was a life event for intended parents, it's a really big deal to be a surrogate. That's something that you tell people, I was a surrogate for a family, and it's a big life event for them as well.
Yeah, it totally is. And we have intended parents all the time that will fly their surrogates and their families out to them to visit with the baby, and they'll spend the weekend together. And I think those relationships are really special. I love hearing those stories, and I think that's amazing. It's incredible when that happens. So
most definitely. And then we always recommend, or I think for any pregnancy, to get your surrogate or new mother a push present. It's just a nice gesture.
During a surrogacy pregnancy, some intended parents are of the mindset that, well, this is a compensated journey. This is a surrogate, so why should I be buying additional things throughout the journey? One thing I want to stress is the push present doesn't have to be anything super expensive.
No.
And, quite honestly, for all of the stress and sacrifice a surrogate is undergoing to help you have a baby, the least you could do is, something for her after the delivery. So
a bathrobe, a nice lush
something.
Plush blanket.
Adam and I would bring a gift bag. We'll bring a gift bag with some nice lotions and some oils and some candles. And then we would also put like a gift card to like a local spa, so that after her journey, after delivery and she's recovering, she could go get herself like a nice body rub and maybe get her nails done and feel beautiful and pretty again, because a pregnancy kind of can take all of that out of you.
It's draining.
Yeah.
It's draining. So just something to recognize the work. And again, it doesn't have to be diamonds, and just something nice. And that'll be based on your surrogate and her personality and your personality and all that good stuff. So there's one more thing I think we wanted to address, and that's every pregnancy is different. So when we recruit and vet surrogates, they undergo medical exams, and we look at their complete medical history and their pregnancy history and their delivery history, and they're all very healthy, age-appropriate women with healthy lifestyles. They're financially stable. They're mentally stable. I mean, a lot of requirements. So if something does go wrong in a pregnancy, it's not a surrogate's fault. It's nothing that she did wrong. You didn't get a bad surrogate. For example, maybe she gets gestational diabetes, just an example. It's sometimes, in lots of women, they'll notice that their first pregnancy was entirely different than their second pregnancy, and that's just pregnancy for you. That's why we tell you to stay cautiously optimistic, because you just don't know.
If you've gone with a reputable agency like Golden Surrogacy,
like Golden Surrogacy, seriously.
You're exactly right. We go through the records, we have them vetted by a reproductive endocrinologist, and we make sure that your surrogate didn't have complications in her previous pregnancies.
Exactly.
So if something pops up, that's part of a pregnancy. They can be unpredictable.
Oh, yeah.
So it's important to be supportive, and then make sure that, she sees her medical professional right away for intervention. But yeah, above all, just be supportive. Pregnancies are, they're unpredictable. But going through a surrogacy agency definitely helps game out everything and reduce risk. So that's very important.
Exactly. Any more thoughts, Frank?
No, I would just say, we went through the first, second, and third trimester. We kind of grazed through each stage of a pregnancy. There are many more medical terms and things that you could research on your own, or talk to your surrogate's OB or to your reproductive endocrinologist to know all of those scientific things. What I would caution is doing too much research is just going to stress you out even more.
Yep.
What you might want to do, though, is maybe talk with your reproductive endocrinologist before your surrogacy journey starts, and ask them about, what are the complications or risk factors for a surrogate because of the extra hormones she'll be on. If you'd like to understand even more in depth from a medical perspective or a scientific perspective, definitely have those discussions with the doctor so that if something does happen or she's a little moody or whatnot, you understand all of that, and hearing it from the doctor helps even more. So
basically, like, be aware of the hurdles, but don't create the hurdles. So don't look for things to be worried about, but be aware of the things that may go wrong.
Yeah, definitely. I think cool. Adam and I went through our surrogacy journeys just very happy and optimistic, and we knew that our surrogates were doing the right things, and we stayed engaged and we supported her. So those are my key takeaways. And lastly, just enjoy every stage of the pregnancy. It does go by really fast. I know you think to yourself, oh my goodness, 9 months, but it flies by.
Gosh,
it really does. So enjoy every stage of the pregnancy. Enjoy your surrogate. Build that relationship, and make sure that your story, your journey, your child's origin story is one that is positive and built on a strong foundation of trust and respect with your surrogate. But that's all I have.
Awesome.
This was a really fun podcast. We need to do this again. We need to maybe interview a doctor on some of these stages.
Yes, that can give a little more detail.
They'll get a little more,
medical.
Medical. We'll get in there.
Because this is just experience-based again.
Yeah. Yes, again, we did not provide any medical advice during this podcast, just personal anecdote based on
just awareness.
Our surrogates that we've had in our program. But thank you, everyone, for listening. And if you follow us online on social, our Facebook is it's always at
Golden Surrogacy,
except Instagram, which is Golden
_Surrogacy.
And until next time, this is Frank Golden reminding you that everyone deserves a family.